Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, join me and my co-host Alex Ross as we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss a smart patch for diabetes, online healthy living classes, a grant to fight the opioid epidemic, and cancer screenings. Let's wrap things up. This is episode 31 for the week of May 4th. I'm Matt Moneypenny.
And I'm Alex Ross.
May the 4th be with you. Before we get started, our diagnosis code of the week is W55.41, bitten by a pig.
You know, interestingly enough, Matt, this has happened to me actually quite recently. Mm-hmm. I'm starting to think that you're actually just going through my medical records.
I am.
To come up with these ideas each week.
Exactly. I end up going to the hospital so often.
You know, we talked a little bit about how I tried to start getting exercise, and that didn't really work. So I tried to do something a little more less public, you know, and that didn't work either. So I guess my thought was I need to get exercise somehow, right? Yeah. So what way can I do that where I don't have to go out in public, but I can still protect myself from birds? Mm-hmm. And so, you know, like any normal person, I built a small barn in my backyard and adopted some pigs.
Wow.
Yeah, I became a farmer. I mean, you got to do what you got to do. You got to keep yourself active. And I thought, what better way than adopting a couple cute little pot-bellied pigs and maybe a goat or two coming in the future. But that was kind of short-lived because about 3 or 4 days into having these pigs, my neighbor came over and was telling me, you can't have these pigs. They're not allowed within the city limits. You need to get rid of them. I'm going to snitch on you. Get rid of the pigs.
Wow.
And so I said, no, I'm not going to do that. And I picked up one of the pigs, and I was going to take the pig to the neighbor and make the pig bite the neighbor. But the pig bit me. So yeah, right on the hand, my left hand, and it was a pretty good bite. So I don't know. My hand is sort of healing, but basically I'm all right now.
I gotta say that was a boring story. You get it?
Because bore.
And with that, let's get right into the news. First up, we have Patch Up Your Risk for Chronic Illness. A small patch device designed to monitor users' health at a molecular level is in development to help reduce the risk of diabetes. It will measure dietary biomarkers in the body and send it to the app. This nutritional data lets the user know how their bodies respond to different foods to help them personalize their diets. It's described as the world's first personalized nutrition wearable. The patch attaches to the user's arm and combines a complex sensing platform and stretchable electronics that sit on the skin. It goes beyond current wearable technologies as it targets precise biomarkers that drive lifestyle-related diseases like type 2 diabetes.
I have a feeling that in the future, our shirts will just no longer have sleeves because they won't be necessary because our arms will be just entirely covered by these wearable devices.
Or conversely, our shirts will be wearable devices that
there you go.
Everything on the interior, and the problem is you can't probably wash them, so you're just going to be smelling because you're wearing the shirt every day, all day.
Well, no, it would be a synthetic material that just doesn't smell ever because it can't intake the human smells and then hold on to them. So
wow, I think we just came up with $1 million idea.
If someone wants to steal that, you can send my check to P.O. Box. No, I'm just kidding. But we've been seeing a lot of wearable type technology, a lot of like monitoring devices in a lot of different areas of the body space. Yeah. And we seem to be moving towards this world where everything can be monitored at all times. Meaning, I suppose we're going to unlock the key to perfect health at any moment.
Yeah.
It seems like a lot of work, though. I mean, the app seems to do a lot of the work for you, right? The computational stuff, the tracking stuff. And that's convenient and useful, especially with specific cases like type 2 diabetes. I don't see this being applicable to a wider audience, though.
Yeah, it's definitely a pretty niche piece of technology, but I think maybe they might be able to team up with someone who has different devices and caters to other health, and then they can probably come up with a different kind of device that does everything, right? So
right. So
who knows?
I think a lot of it comes down to a trade-off, right?
Mm-hmm.
I wear a Fitbit because it gives me a watch, right? I get to check the time, but also I have these added benefits of tracking my movement and my exercise and my heart rate and those kind of things. So if they wanted to integrate this kind of technology into something like a watch, now I get that gets complicated because it needs to stick to the skin in a certain way. But, if they wanted to implement the technology in some way that there is a trade-off, something that I get at a very base level, then maybe I would consider like adapting my current process and kind of what I'm doing to this new device so that I can make use of it. Right. And that's the challenge, is overcoming that initial like friction to getting started using more of these monitoring devices and what that implies for the community as a whole.
Mm-hmm.
Next up, Giant health and wellness benefits from online classes. Giant Food, the Greater Washington, D.C. regional grocery chain, announced that it's offering free weekly online nutrition and healthy living classes. These are aimed to support the greater community and individuals with chronic illnesses. The classes serve as an extra preventative measure to ensure healthy living habits in between doctor's visits. It's led by a team of 11 licensed nutrition professionals to offer advice for effectively managing health through simple diet and lifestyle actions. Giant is also offering free personalized online consultations for customers who have questions about their health and wellness. These consultations are by appointment only. We're seeing a lot of different, not just food and grocery, but also retail chains moving into the healthcare space and the online space because of the entire shutdown that's been going on. It's not just Giant. I mean, locally we have a few video rental stores, right, that are now advertising that they offer telemedicine doctor visits in their shop.
Yeah.
And that's such a wild concept to me. Like, I never would have dreamed that a video rental store, 10 years from now would be offering doctor's visits. Like, that's insane. And now we got grocery stores too. We got grocery stores. We got video stores. Who's next? The restaurants are going to have a simple button in the middle of the table that
out comes a doctor with a gurney ready to go, wheel you into the emergency room.
Oh no, I was thinking more along the lines of like you push the button and a doctor comes out so that you can review the menu with them and they can help you make smart choices for what you're going to eat tonight.
He's like, look, John, you got diabetes. You can't go for the ribeye tonight. I suggest you go for the couscous drizzled over some lemon zest sauce.
Exactly.
I mean, these grocery stores are just trying to stay relevant, right? And it's the perfect time to do anything health related right now, given the circumstances of the coronavirus. So,
right. I don't know if I would say stay relevant, like, right? Because a grocery store is always going to be relevant. Well, you're always going to need
compared to their chains, right? Like, I mean, if there's a million grocery store chains, they have to do whatever they can to differentiate themselves from their competitors.
Right. So. That reminds me, and I don't know if this is the same company. The grocery store chain Giant Eagle.
I think they are the same company.
I'm trying to find out now. No, it does not appear they are.
Wow.
Based on the logo that's on this story. We have a local grocery chain called Giant Eagle, and Giant Eagle used to offer, they called it the Eagle's Nest. And it was basically like a room where you could drop off your kids and they could like play and, I don't know, relax while you went and did your shopping.
Frolic through the...
I have a few distinct memories of it. The first one is that they gave all the parents like a walkie-talkie. And if the kid had to use the bathroom, they had to call the parent on this walkie-talkie, and the parent had to come get them and take them. It was kind of entertaining. But the reason I bring it up and the reason I was thinking about it is because that room was honestly one of the biggest cesspits of disease. I mean, think about it. Just like a bunch of dirty kids randomly thrown into a room, all playing with the same toys. And it's not like a daycare where it's the same kids every day. It's like different kids every day. And they don't do it anymore, but I'm trying to imagine that place in an era of coronavirus. That would have been a huge issue.
Yeah, I agree. I mean, I'm glad they moved away from that, because as soon as you said that, I was like, ooh.
I mean, it was an interesting concept. And like, as a kid, I appreciated it. Like, I always look forward because, they had a PlayStation. I don't have a PlayStation at home. Yeah. So it was kind of cool. But at the same time, I also have memories of being kind of ornery and not wanting to use the hand sanitizer as I entered. And I can only imagine that there were other kids who refused.
Agreed.
So.
Next up, nursing the New Mexico area to better health. New Mexico State University received a $200,000 federal grant to expand the number of nurse practitioners fighting the state's opioid epidemic. The grant will provide funding for the NMSU School of Nursing faculty members in the Family Nurse Practitioner program to develop a curriculum that emphasizes integrated mental health and primary care. The program is delivered in a distance education format, so nurses throughout New Mexico and the adjacent border region can earn degrees without relocating. So it's good to see that there is still enhancements happening for programs for other diseases outside of coronavirus, right? I mean, this isn't necessarily a disease, but it's still something that needs to be addressed. So
it's easy to forget right now that there is still a lot of other turmoil and a lot of other challenges, especially, healthcare type challenges that exist in the world. I mean, we're not really thinking about those things right now. But, things like opioid addiction, they're still happening, and they're still, killing people. It's still messing up lives significantly and causing a lot of harm. So I appreciate seeing stories like this come out where, even though we have something really big to focus on right now, there's still this other work that needs to get done, and people are getting it done. So that gives me a lot of hope as we move forward. Next up, seeking the presence of cancers. An innovative blood test that screens for cancer has shown promising results in a Geisinger study of more than 10,000 women. Researchers found that the blood test called Cancer Seek can successfully screen for several types of cancer, including those for which there's no other screening test. It screens for 16 genes and abnormally high levels of 9 protein markers that can indicate the presence of the disease. The test's false positives were low, and detecting cancer early before it spreads will allow better treatment and health outcomes, yet there are currently no effective screening tests for most cancers like ovarian cancer. But this test has the ability to detect them at an early stage when they're most amenable to treatment. More information is needed before the test can be used in routine patient care, and the researchers will continue to evaluate how this promising technology can support care. Honestly, I'm surprised to hear that we don't have tests that can detect a lot of types of cancer. I really didn't know that.
Yeah, that's definitely surprising for me. But there's also so many different types of cancer, right? And it's kind of crazy to me because when I was younger, you'd always hear when you're younger and just in general, you always hear of people donating towards this specific particular cancer research and all this. And when I was younger, I was like, man, why do they keep donating all this money and nothing happens, right? But it's just because that's such an insane disease and there's just so many of them that it's almost entirely unpreventable. But now we're at a point where technology is starting to come to fruition and actually pay dividends towards cancer research. So it's awesome to see that kind of thing happen, right?
Yeah, and obviously the earlier we can detect things, the better.
Yep.
Cancer. Yeah, absolutely. One of the challenges though with cancer is that at a stage where it wouldn't be detectable by a test, you often aren't seeing the negative health effects yet, right? It's not really starting to affect you in a way that you can tell. And so you're not thinking something's off, I need to get checked. And that's the challenge with cancer, is that we often don't notice until it's gotten bad. So I'm hoping that tests like this that screen for many different types of cancer, these can sort of become a normal thing. You go into the doctor's office for your yearly physical, and we can just do a quick screening and just see if there's anything else we need to take a deeper look at. Even though this test has some false positives, it gives us a place to start. It says, ooh, we might want to take another look at this certain area because there could be something off.
Right. And with that, let's go into our next segment.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Welcome to Breach Patrol. We talk about the latest cybersecurity breaches all across the world. First up, we have Optus makes an oopsies. The telecommunications company Optus was hit with a class action complaint after it mistakenly published names, addresses, and phone numbers of about 50,000 customers in white pages. The law firm Maurice Blackburn said this is the first class action brought against a telcor under the Privacy Act. The action claims that Optus disclosed private information originally collected for Optus services without the consent of customers. The action will go before the Australian Information and Privacy Commissioner to seek compensation for the affected customers in what the law firm is calling a test of Australia's privacy laws. We're going a little bit further than normal. Usually we're talking about United States, but this is Australia now. So welcome down under,
Where everything is upside down. No, I gotta say, the optics for Optus is not optimal.
No, it's not. I wonder what all entails with Australia's privacy law. Clearly, it has to do with customer information and what can and cannot be shared without consent. So it seems like it's a little bit like HIPAA, but it's a lot of consumers, so it's a little bit more strict. It seems. It's a privacy law designed to protect consumers and their information. Obviously, just like many other countries have adopted. I think the biggest issue with this one for Optus, though, is that it was collected originally without the consent of the customers, right? They didn't know that their information was being collected. And then it was further used. It's one thing to collect that information and use it internally to provide a better service for your customers. It's another to then go and either, spread that to other companies, sell it, distribute it, whatever. Right.
That's the issue here.
Yeah, and you're starting to see a lot more regulations just across the world, with GDPR recently getting put into fruition in 2018, I believe. That was a lot more strict on what companies can and cannot do in order to track consumers and also what they do with their data. So it seems like a lot of regulations are just starting to get more strict, right? So they're kind of looking at HIPAA. They're saying, hey, this is working for HIPAA. Like, what can we do to protect the consumer, not just the patient?
Right. I'm a little concerned. This seems, I won't go too far with this line, but I am a little concerned with getting to the point where we're just throwing more and more regulations at things, right? Because criminal statutes and regulations that we then prosecute are designed to punish people who break them, not necessarily proactively prevent them. Now, we can do that in some cases, and I think there's a reasonable level that we can do that with consumer information. My concern is that, a one-person business who just runs a mailing list to send out email now has to follow GDPR and implement all of these different policies and be able to prove that they're doing that. And that's a lot of work for that one-person operation. And it makes the barrier to entry for very small businesses even higher. And at some point, we can't keep doing that.
Right. Agreed.
But companies like Optus doing this crap, that obviously that doesn't help. So, guys, stop. Behave.
Do what you're supposed to and be a good business. Thank you.
Next up, which type of breach would you like your sandwich on? The sandwich chain Primo Hoagies Franchising Incorporated is facing a class action lawsuit from customers affected by a data security breach. It failed to protect customers against the theft of payment card information. The breach allowed one or more hackers to steal the information for online customers between July 2019 and February 2020. This may have included names, addresses, payment card numbers, expiration dates, and security codes. The lawsuit estimated that affected customers are likely in the millions. It seeks unspecified compensation and punitive damages, as well as at least 3 years of identity theft and credit card monitoring services. The lawsuit was brought by Primo Hoagie's customers whose account was used for fraudulent purchases last September. Be careful where you get your sandwiches, Matt.
Yeah, watch out. Would you like some mayo and a little bit of side of punitive damages? Oh, yes. You want the punitive damages? Would you like to make that a meal and add some compensatory damages as well? Primo Hoagies, man. Yikes. This is not a good look. I feel like it just goes to show you it doesn't even matter where you go anymore. Your privacy is at risk, literally anywhere.
I do wonder how these kind of things happen with individual companies, though. Because, right, Primo Hoagies, while it's a pretty big franchise from what I can tell, they don't do their own payment processing, right? They're using some other company to do that.
You'd think, but...
So where... Did they set it up wrong? Did they, save information incorrectly, trying to cut corners or something like that? What caused this to happen, and why do we see this happening with payment card information, right? Yeah. Who is at fault? Is it Primo Hoagies? Is it the payment processor? And what do we do to prevent that in the future?
Yep. So always stay alert, Right when you're eating that lunch sandwich, make sure you're checking your credit card information every single time. I mean, that's just not realistic, but the point is that you should at least have somewhat of an idea, right? So if you see this in the news, if you went to Primo Hoagies recently, you should probably contact them and try to figure out if you had any problems with your information getting breached. So,
right.
But if one thing's for certain, it's that all this talk about sandwiches is making me hungry.
Absolutely. I think it's time for me to go get some food. So that's it for this week's wrap-up of your weekly healthcare and cybersecurity news. I'm Alex Ross.
And I'm Matt Moneypenny.
And we'll see you next week.
Thank you for joining us for this week's episode of The Bandage. This week's episode was written and produced by eTactics. eTactics is a leading revenue cycle solutions organization committed to providing innovative, web-based solutions that improve our clients' cash management and customer relationships. Thanks, and we'll see you next week.